Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness and is brought to you by Freedom from Addiction.
Welcome to Living Clean, Living Well, everyone. I'm your host, Teresa Cruz, and it is great to be with you. I'll tell you what a week it's been here in Canada, very newsworthy on a number of issues that affect you, our wonderful viewing audience. First of all, on Thursday, our founder and CEO of the Canadian Centre for Abuse Awareness, Ellen Campbell, myself and my husband, Gary Cruz, were invited to a news conference and announcement by the Prime Minister of Canada, Stephen Harper. And he there told us that he was making a historic and landmark announcement that the Canadian government is putting together a Victims' Bill of Rights. Now, this is huge, and it is something that you need to know about. Maybe you did hear about it in the media. And I know it's huge for you because you've called in to us and you've told us that many of you have been victims of crime, of violence, of abuse, of sexual abuse. Well, now the victim's voice is going to be heard. And with this new Bill of Rights, and it still has to go through its readings and the debates and all of that, but they're very hopeful that this legislation will go through. But this will give you the right to information, participation, restitution, and also protection. So we're going to keep our eye on that in the coming weeks and months, and we'll let you know how that's going on. They gave us a sign, and they are supporting victims. Now, my late brother-in-law, Martin Cruz, he always said, I am not a victim, I am a survivor. So I guess they couldn't really call it the Survivor Bill of Rights, but anyway, we are very, very pleased and proud to be a part of this. There was about 30 groups and individuals whose lives had been touched by violence that have worked many years, very long and hard, Ellen Campbell being one of them, to bring this to fruition. So we're very proud, and we'll keep you informed. The other bit of news that hit, and you may have heard about this too, the new medical marijuana regulations have now taken full effect as of April the 1st. So what does that mean? Well, the news media immediately told us about several medical marijuana clinics that are going to be opening up in Toronto. Here's the article from the Toronto Star. Now, one Toronto clinic owner is thinking of opening up 2 clinics in Toronto and then also expanding to Halifax, Calgary, and Edmonton. We also heard about a Vancouver pizzeria owner who sells prescription pot pizzas. So I guess the marijuana is sprinkled on top, or it's infused in an oil, but you do need to have a prescription. Now, he's in Vancouver, and he is thinking of coming to Toronto next month to scout locations for that. So as you can imagine, there's been an awful lot of conversation about this, not only in the general public, but also in the medical community. So as we get done our news for the day, I wanted to bring in Dr. Vera Tarman. I thought who better than to discuss the medical marijuana issue, as well as Vera, but also with you as well. So welcome to the show, Dr. Tarman.
Hello, Teresa. Always good to be here.
You betcha. So the big news, Dr. Tarman, about these medical marijuana clinics that are about to come into fruition. What, from a medical point of view, what's your thoughts?
Well, the Canadian Medical Association does not approve of medical marijuana. It doesn't approve of any kind of medication that has not actually been researched fully. We don't know what dose, we don't know what the well, we have a sense of what the side effects are, but we don't, how are we supposed to prescribe something when we haven't actually been trained to use it yet? This is a civic decision, it's not a medical decision. Doctors are not happy about this.
Mm-hmm. You know, you and I were talking, and I'd like to get a little bit more into the background as to why the doctors aren't happy. A, you're saying information. You don't know enough about marijuana, and I mean, it's something that you have to inhale into your lungs and hold, and we all know what smoking does, can do.
That's right.
But what else?
Well, I mean, it's not that we don't know, like we need to be educated. Like one of the things that these clinics says is that they'll actually educate doctors. We need to get the research that actually shows this, and there is some research to show that it helps with glaucoma, and it helps with cataracts, and it helps with various conditions. But there's no research about how to actually, you know, is this amount, should I prescribe this amount versus this amount, and what happens to target populations? Can I give it to pregnant women? There isn't any research in that facility to actually do it in a legitimate way where the benefits will outweigh the negatives. And that's the piece. It's not like doctors are saying no to marijuana, but it's too soon. We just don't know yet how to use it.
And it's quite a process in order to work a patient up and all of that.
I mean, any kind of drug has to go through a whole approval process. That has not even happened, not even close to that.
So why then? Why are they moving so quickly? You said it's a civic decision.
Yeah, it's a civic decision. It's a court decision. I'm guessing it's a harm reduction. It's cheaper, you know, rather than put people in jail or arrest them. Or I don't know. I really can't ascribe motive. But the doctors have not been asked, and if they had been asked, they would have said no, thank you. And you know, we are now the gatekeepers to this process, and we're not happy about it.
One of the people that are thinking of opening up one of the clinics was quoted as saying in that Toronto Star article that doctors are uninformed about the benefits of cannabis because it's not taught. Doctors who have been in practice for a while do not want to be in that role. They don't want to be prescribing you something that they don't know what it's going to do.
That's
you
right.
agree?
Yes, I agree with that. But he's implying that he has information that we don't have. None of us have that information. I mean, he may have his own, shoot from the hip, his experience. But that's one man's experience. That's not a research study where you've looked at a number of patients and looked at all the different variables. I'm not going to go with one person's experience. So it's research that we're needing, not information that he has.
So at these clinics, will there be doctors there?
Yes, there will be doctors there, and they're going to be doctors who are willing to. Well, now they're approved. I mean, they're legal, but because it's not accepted medically, they are still stepping outside of what we call the standard of practice, and they're willing to do that, obviously. And I mean, why not? I mean, there's a huge financial incentive, which the article doesn't disguise. I mean, they all say this is a tremendous business opportunity.
So what's the overall feeling from when you talk to, have you had patients that have requested medical marijuana
yes.
or are on
Yes.
it when they come to see you?
Yes. I when I was doing only family medicine, I was asked frequently, and I mean, I was a young and hip doctor, and I thought, sure, no problem, and I did actually make the approval. There's a couple of different processes which now are defunct. But over time, when I saw what some of the consequences were, and then especially when I got into addiction medicine, I had to back off, and I said no. And I must say that the flavor of my practice definitely changed. I had an exit of a number of people because they found these doctors, which existed. I mean, it's just that they existed sort of under the radar.
Consequences, Dr. Tarman. You said you became aware of the consequences. So what were you seeing?
Well, number one, addiction. It is a gateway drug. And first of all, it is in and of itself addictive. I mean, I work at Renaissance, and I see patients only on marijuana coming in for addiction, and they say, they've tried to stop using and they can't. It's impaired their school performance, their work performance, their relationship performance, and they can't stop. So the addiction is the number one thing. But I would say that outside of that, the mental health consequences, anxiety is increased, psychotic episodes are increased. I mean, I couldn't in good conscience continue to prescribe it. And people said it helps my anxiety, but I saw that their anxiety was actually deteriorating over time.
Well, great insight, and what a way to get into our show. Very topical right now. But I also wanted to bring Dr. Tarman on as well this week, because I've noticed in the last few weeks we've had many people calling in wanting to get, they need guidance on certain drugs that they're on, whether it be for anxiety or for managing their pain. Which also feeds into the medical marijuana topic of discussion. But a lot of them were asking about some medical advice. So I thought we need to do Ask Dr. Tarman segment. So here she is. Many of you who watch us every Sunday night know how valuable she is and the information that she gives from a medical point of view. So here is your chance. Would you like to talk about the news that we have heard about the new medical marijuana clinics? Are you someone that is for this? Do you use this service? Will you use this service? What are your feelings? Are there other people out there that feel that it must be totally abstinence-based? We talk about that regularly here on the show as well. So we'd like to hear what you have to say about that with the topical news of the day, but also, as always, with your general questions. If you or a loved one are struggling, have some questions about what you may be going through with addictions or substance abuse, violence, trauma, we're here for you. So we'll open up our toll-free lines and give you a chance to talk to Dr. Tarman. Our first break here on Living Clean, Living Well. We will be right back.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Welcome back to Living Clean, Living Well. We are live here with you on CTS television tonight, a proud presentation of the Canadian Centre for Abuse Awareness. My guest, Dr. Vera Tarman, the medical director at Renascent. We are going to open up our toll-free lines to you. So if you have some questions, or maybe you'd like to make some comments on the news of the day that we were talking about before the break, please pick up that phone. Here is your chance. Give Dr. Tarman a call. When I talk about the news of the day, it's the fact that the new medical marijuana regulations have gone into full effect as of April the 1st. And that means that the medical marijuana clinics can open up. And we're hearing through the news that there's going to be several that will be opening up. Dr. Tarman, we were talking earlier as well, and you were saying that there is actually a pill that has the same effects as cannabis. Is this correct? Could you tell us about those pills?
Yeah, one of the things that I think people may not be aware of when we talk about medical marijuana and the benefits of it, like, as I said earlier, it's not really that doctors disapprove of that. We already know that it has effects that are useful, like for nauseousness, for persons, for pain with cancer, whatever. I mean, we already know that, and there's actually two medications that I can prescribe right now, and I have prescribed. Nabilone and Sesamin are the trade names for them. And they've been around for 10, 15, 20 years. I don't know how much longer. And I mean, they've done the job. And the people who are so insistent on having the smokable version, I don't know what to say. I don't know. I mean, it already exists, medical marijuana. Yes. I mean, I have my own private suspicion, if I can say, that when you smoke something, it goes to the brain very quickly, and you get that rush, that sort of high, that giddy, happy feeling that you get when you smoke a joint. You don't get that with the pill, because it doesn't go to the brain. It takes a half an hour for it to work.
But it also lasts a lot longer. You were saying up to 12 hours?
It lasts much longer. So, well, from a medical marijuana point of view, you want something that's not going to make you impaired and that's going to last a long time. So, I guess what's all the fuss about? We already have it.
No, yeah. I know. Well, it's newsworthy. It's coming to, for anyone that is from Toronto or knows the area, one of the areas they're thinking of opening up the clinic is right at Yonge and Eglinton, which is a huge corner of Toronto, one that's very noteworthy within the city. So it's not like, it's going to be right there.
And in the paper, they make it very explicit. They don't hide the fact that this is a tremendous business opportunity. So I do think that there's some profit motive happening here too.
We'll have to see how this plays out over time.
Yeah.
It's your turn now. Let's go to our toll-free line. Let's go to line 2. Calling in tonight from Aurora is Linda. Hi there, Linda. You're first up on our show tonight. Go ahead. You're talking to Dr. Tarman.
Hi. I'm a recovering addict. I never really got into marijuana at all, but I can tell you about 2 experiences I had. When I was in Barrie Detox in '95, and I've been sober since then, they showed us a normal brain, an alcoholic brain, and a marijuana brain. And the marijuana brain was as disfigured as the alcoholic brain. Then I went up to Elliott Lake for codependency, and there were a huge number of patients that were utterly codependent but could not get off marijuana.
Right.
And it was causing trouble in their families, with their children, and it went on and on. I've heard that it's harder to get off than nicotine, and I'm totally behind Dr. Tarman. Thank you for standing strong in the medical community, because it is a fast way, and there's people now infiltrating AA that are trying to pass on the use of marijuana, and I find it totally unethical. Thank you.
Thank
Linda,
you, Linda.
wow. That's great. A great way to start out the show with someone with conviction and the experience that she's had in her life to back that up. Your thoughts on what Linda
Well,
had to
I
say?
mean, Linda just underscored what I was saying earlier, that marijuana is an addictive drug, and I think people tend to think that it's not, it's a benign drug. We have this impression that it's, from the 1970s, just makes people laugh and a little forgetful. Well, the drug that we're talking about today is not the drug of 1970s. It's much more potent, like tremendous. It's 20 times more potent. It's so potent, in fact, that cocaine users will say, "I don't want that stuff. It makes me too paranoid." They don't want to take it because it's too potent. And that's the drug we're talking about. It is just as addictive as the others, as far as I'm concerned.
Let's go now to line 3, and Ron's calling in tonight from Hamilton. Hi there, Ron. You're with Dr. Tarman tonight. Go ahead.
Yes, hi. I'm wondering about if somebody is given medical marijuana for whatever reason, for some illness they have, and it produces signs and symptoms of depression or anxiety or such illnesses like that. If they are then given medications to counteract the anxiety and depression, wouldn't the marijuana be a stimulant that would then again counteract the medications they're taking for the depression and anxiety?
Sure, of course. I mean, yes, I would totally agree with you. I mean, the medical marijuana what creates anxiety. I mean, it's actually a stimulant, and will overpower any antidepressant that a person will take. Your point is quite correct. We often have to take meds to counteract the effects of other meds. And I didn't actually think about that. If people are taking medical marijuana, what medication are they going to have to take now to counteract the effects of that? Probably antipsychotics, because medical marijuana has a connection with schizophrenic or distorted thinking.
Ron, did you have a follow-up comment or question?
No, I pretty much figured that's what the doctor was going to say, but I thought it was an important fact to get out there on the air for people that didn't know that.
Yeah, absolutely, Ron. I'm really glad that you called in tonight and brought that up. I've always said this is a great forum for sharing, and you guys are as much a part of it as us that sit here week after week. So thank you for sharing that. That's, also something to think about. And I'd like to put it out there, too. Is anybody watching tonight that is actually taking medical marijuana? Have you been prescribed? Would you mind calling in and telling us about your thoughts as to, the prescription, why you've had to go on it, and that sort of things. I think I'd like to hear from you as well. So if somebody out there that has been prescribed marijuana, please give us a call. We'd like to hear what you have to say, too. So now let's go back to the phone lines. And line 5, and Anne is calling in tonight from Scarborough. Hi there, Anne. You're live on the show. Go ahead.
Yes. I just want to ask Dr. Tarman, what is the difference about a patient who's been prescribing, and like a doctor who prescribes a lot of medications and didn't find the exact problem with the patient, thinking it was, let's say, MS, and that person, or the doctor, I should say, hasn't researched enough and has prescribed other pills, and this patient has taken too many pills and it doesn't even help. Now, marijuana, I don't know how it works, but I understand there is medicinal. You could be under the doctor's care, but I think doctors today know that marijuana, the plant, has been years and years back. We've had it probably in our garden and that, and we never even experimented with it. We just picked it out and maybe just put it in a garbage, and we didn't think much of it. But maybe other people, younger people, started to experiment with these plants, and this is how I'm trying to understand how they became or how they got involved in this marijuana.
Well, I want to say, Anne, that doctors didn't get involved. They've been always fairly reluctant for the exact reason that you're saying. Why would we use something when we don't really know how, we don't even know what the full effects of marijuana are. We've only just discovered the receptor site. Like, this is new information. And to actually use this as a medication, it's like working blind. And unfortunately, that happens a lot in psychiatry in any case, that you know, you don't really know what the diagnosis is, and often it's, if the medication works, well, that must have been the diagnosis. It's a little bit of hit and miss anyway, but in this case, it's going to be like working in the dark, really, in that context. I do want to say one thing, if I can.
Yeah,
you asked me about a patient. When I have prescribed the pill form of it, what I've actually, what I remember people telling me, because I did this a lot in the 90s when HIV was really rampant, and people were really sick with the meds in those days. And they said that it really helped, like with the medication. It really helped with the medication. It really helped with some of their peripheral neuropathy, their pains. But they didn't like the groggy feeling, and sometimes they chose not to take it for that reason. But I mean, it has a help, and we know more about the pill form, how that works, and how to use that than we do about this.
About the smoking.
About the smoking,
smoking
of which there are multiple varieties. You know.
Yeah, and also, Anne, please don't think that the medical community is for this. Generally,
yes,
they're not.
No, they're generally quite reluctant about it. I mean, they weren't asked about this.
Yeah, it was a civic thing, so a court-ordered decision, correct?
Yes, it's a court decision, not a medical decision.
Not a medical decision. And in fact, if you want to reiterate that point about the OMA, they came out and said...
Yeah, last year, because so many people were being asked to fill out those forms, this is in the previous way that you could get it approved, so many doctors were saying, what do we do with these forms? The Canadian Medical Association actually sent out a sort of protocol or guidelines saying that we do not approve of medical marijuana. Now, you can stray outside of that, but it means then that the onus is on justifying why you are straying outside of it. I've tried multiple other methods, and I'm now resorting to this because it's the only thing that seems to work. Whereas now, the implication will be I don't have to do all that.
Yeah. Gotcha. Thanks so much for calling in. I hope that is helpful. Let's go now to line 7, and Elena's calling in tonight from Toronto. Hi there, I hope I said that correctly. Is it Elena or Elena?
Elena.
Elena, terrific. Elena, go ahead, the floor is yours.
So I have a daughter who recently asked to move back in with me, who's 24, who's decided that she was a drug addict, or acknowledged that she was a drug addict, and she wanted to get off amphetamines. But she is having a really hard time getting off of marijuana. She's been okay with the amphetamines and been doing incredibly well. And there's also a family history of mental illness, which she's acknowledged that it makes her feel psychotic.
Yeah.
But she just can't get off of it. And I'm a shiatsu practitioner, and I told her that I gave her several conditions of moving back in. One was that she get weekly shiatsu from me, and she also would take yoga every week. And because I was trying to figure out how to help her to deal with the reasons that she smokes marijuana, to like give her some kind of substitutes. And I was wondering if you had any insight or suggestions about other things that would help someone manage the reasons that they go to marijuana to begin with.
Well, I want to first of all say that the reasons don't matter at this point. She needs to stop the marijuana. Finding the reason, it's like, you know, finding the reasons. If you want to stop drinking, I've got to find the reasons to stop. No, you need to stop drinking, and then the reasons, you'll have the mental clarity to deal with understanding the dynamics after that. So how does she do that? Because, I mean, you're right. Thank you for raising that point. It's a very hard drug to stop, and it is addictive, especially when people are smoking a number of times a day. The more you smoke something, the more addictive it is. I mean, that many times in a day. So what she may need to do is actually go into a treatment center believe it or not, people go into treatment centers for, like I said, with Renaissance, we have a number of people who are going in just for that. So you may not know this, but treatment centers are an option. There are a number of places, counseling centers for addiction that deal with youth and marijuana. So, I mean, if you need a referral, I can give you one. And then, by the way, you may not know this, but there's actually a 12-step program called Mariuana Anonymous in Toronto, and it's now got a fellowship that manages to get a meeting once a day. Once a day, like every day of the week. So it's that big that it can actually sustain that. So there is help out there if you see that this is an addiction like the amphetamine and needs to be dealt with in the same way.
How would you find out where to find the Marijuana Anonymous?
Just type on the
just
internet.
Google it?
Yeah, Google Marijuana Anonymous Ontario.
Toronto,
Yeah, Toronto.
And that should come up for you.
Yes.
Would she benefit from a detox? If you cleanse the body?
She would benefit from, you mean a detox, like going to a detox?
Yeah.
Yeah. Yes, she would if they take it seriously. And yes, they would. If she said, I'm here for that reason, sure they would, because it would contain them and so that she could at least get that number of days. The thing about marijuana, the withdrawal of that, and this is the thing that makes it so difficult, is that it's a very protracted withdrawal. You know, you come off of a stimulant, and it's the first week is horrible, crushing depression, you sleep a lot, and then you start to feel better. Marijuana, you actually peak in your worst withdrawal after a week. And the actual withdrawal takes about 2 to 3 weeks. So I don't know if a detox would be enough, because they're going to want to smoke.
Yeah.
But there are treatment centers that you can go to that will give you that sort of gem of 3 weeks that you need to get over the hump. Yeah.
Okay. Elena, I sure hope that helps you and your daughter. We're going to take another short break here on Living Clean, Living Well, but when we come back, more of your phone calls.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers. But they put me into counseling and everything here after my detox, which was the smartest thing I could have ever done. I got the real demons out of me that I wasn't able to do over the last 10 years with all those other detoxes, all those other treatment centers, from private ones to government ones. And this place has actually given me my life back.
Hello, I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Show, everyone. It is Ask Dr. Tarman night here on Living Clean, Living Well. So we're open to your general questions that you may have, anything to do with addictions and substance abuse. Maybe you have other questions that, maybe your loved one is struggling. We're here, so pick up that phone tonight. Also, we have been talking the topic of the day, the fact that medical marijuana clinics have now been, the regulations have now been cleared for this to happen, and coming to a corner in Toronto near you and soon to Halifax, Calgary, and Edmonton are going to be these clinics. So we just put the question out there tonight, how do you feel? And also we want to hear from someone that may have been prescribed marijuana. We want to hear your story as well. We need to see both sides of this equation. So back to our phone lines. All set to go again? Just before we do, I want to tell you about Recovery Wire magazine. They have recently gone green, and you can order your free copy. It'll come to you online now. They're not doing any more hard copies, but online. So just a fabulous resource for really edgy, some great articles in there. Dr. Tarman is a contributor as well. So Dee Christensen is the editor-in-chief, and Recovery Wire magazine is available to you on their website. So now back to the phone lines. Let's go to line 6. Laura's been calling in tonight from Toronto. She's been holding for a little bit. So Laura, thanks for your patience. Go ahead.
Hi. Thank you for taking my call. I think this is a really interesting topic, and I'm in my late 50s, and as of a week ago, was a heavy cigarette smoker. Could the doctor please tell me what she feels is more debilitating? Because I have a couple of senior friends that do this marijuana habit because smoking is a very difficult subconscious habit to replace. What do you feel is more addictive, nicotine or the quantity in marijuana? I am not a scientist, but I see their lives are much healthier. They don't cough when they laugh. I myself have to quit. I've had bronchitis 4 times in the last winter, and it's killing me. I'm just wondering why we would be suspicious of a drug that, you know, I did ask someone this, and they said once you start marketing, though, and selling it as a replacement of cigarettes, so the preservatives and all the chemicals will make it as difficult or as detrimental to health as smoking would be. But that's a long time in the future. I see my friends healthier that are in their late 50s and using this as a replacement. Could you give me your advice on this?
I'm not sure I understand your question. Are you saying your friends are healthier because they're smoking marijuana instead of cigarettes?
Occasionally, yes. They're not cigarette smokers anymore as of 2 years.
Oh.
I'm only off cigarettes for a week, and I would smoke tea leaves right now, as my grandfather did in the Depression. I am a cigarette smoker, probably addicted to nicotine because my parents were heavy smokers when I was born. And I have tried everything but voodoo, and I am on Champix. And finally, second time on Champix, I have got one weekend.
Right.
And I am thinking, what would be more debilitating than smoking a joint, as I've seen, not all my friends. I'm not saying that this is scientific research on my behalf. I'm saying I know 2 friends that have quit successfully over the 2-3 year period, and they occasionally smoke marijuana in replacement of it.
Well, now you're saying they occasionally smoke marijuana. So, I mean, if they were like a 20 cigarette a day smoker, and now they smoke, you know, once I don't know, 2 or 3 times a week, then the amount of damage to the lung is significantly less. But if you're smoking pot a few times a day, even if it's 4 times a day and you were smoking 20 times a day, I mean, the amount of damage that happens with one joint is equivalent to about 4, I've seen the estimates anywhere from 4 to 8 to 10 cigarettes. So, you know, one joint is equal to 10 cigarettes. I mean, that's a lot of damage. And the reason why is because when you smoke a cigarette, you know, you smoke it and you inhale it and then you release it. But when you're smoking marijuana, you are taking in as much as you can, holding it as long as you can, and then releasing it. And that is not good for the alveoli, like the tissues inside the cells inside the lungs. That is damaging. That is potentially predisposing people to cancer and respiratory diseases. I mean, if your friends are better, I would say that they're lucky, because this is going to be another reason. I mean, it's one of the cons that the doctor has to weigh. You know, is it worth this danger compared to any of the benefits, which I could give in a pill?
Right. Okay, so before, we've got a lot of phone calls to get to, including one from the Yukon. Please hang on, folks. Could you help Laura with any advice on just quitting smoking? She's on Champix. Is there anything else that she could do that might help?
Well, I mean, you could also try, you know, the gum and the patch, like just work down slowly.
And you speak from experience, from what I remember, right?
Yes, that's
you were
right.
A smoker,
yeah,
right?
I was a smoker, but I actually just did the quit cold turkey, and you know, 3 weeks later, it was done. So that's always an option too.
So 3 weeks, if you get through the first 3 weeks, is it?
Yes. It's like with any addiction, you just got to get through that hump, and then you just can't succumb again. That's all. I mean, it's not. That's all, but yeah.
Yeah. Oh, Laura, I hope that helps, and you hang in there, okay? Now let's go to line 1. Norman's calling in tonight from Yukon. Hi, Norman. You're live on our show. Glad to have you with us. Have you got a question or a comment?
Yeah, I had a question or a comment. I guess it would be about the marijuana. I was listening to the lady calling about legalizing. She's against legalizing the marijuana.
Yes.
Yeah, I was just thinking of if they legalize it, would it be more safer for the people, public? Because right now, the way it is, people are buying marijuana, and you don't know what they cut it with. You don't know what's in it when you buy it. So if the government, you bought it from them, you know what you're getting.
It's a big topic of conversation, has been for years, really.
Yeah, I mean, the theory is that if it's regulated, then you'll know exactly what you're buying, and you'll know that you're getting the amount that you say you're going to get, and you'll know you'll be getting it from a trustworthy source. But that is presuming that we actually know what we're doing. which we don't yet. But that is the theory, and that is the justification for the government actually supplying it themselves and regulating it.
So that too is a big topic right now, the legalization. But Norma, what we were talking about as well, and you probably know that, the regulations have taken into full effect as of April 1st. So now the medical marijuana clinics can open, right? Yeah.
Yes, that's
so it's
right.
not legalizing marijuana.
Well, no, but I mean, part of the process is that the government is actually going to provide the marijuana, so it's going to essentially stop the private growers from growing their own. Although that hasn't actually happened yet.
Yeah, for now they said that they need them to keep growing.
Yes, they need to keep.
Demand,
yes,
right?
yes. But the theory is because we're going to get a supply that we know exactly what it is.
Gotcha.
Yeah.
Alrighty. Let's go on now to our next phone call. Thank you very much. Let's go to line 2, and John's calling in tonight from Brantford. John, go ahead.
Yeah, I watched a special the other night on TV. There was a young girl, and she was suffering from seizures. She would have so many of them, and the parents finally turned to marijuana. And neither one of them were smokers, and they didn't, this was just their last hope. And what they had done, it was a strain of marijuana that they had taken the THC out of it, or they had it at a very low level, so that the little kid's not getting high, but it had stopped her from having seizures all the time.
Yeah, I had heard about that as well. Did you hear about that story?
Not specifically,
There's a group of parents down in the U.S. Their children have severe seizures. And John's correct. They're giving them marijuana to help with this.
So I mean, it just highlights the fact that there may well be some potential.
I think it was a tincture or
good
something
uses for it.
They're not getting their kids to smoke it.
No, that's right. And so then I would ask the question: could they take the pill? Which again we already have. But it does show that marijuana does have a use, and they use it as a last thing. They tried other things first.
Thank you so much for calling in. Now let's go to line 7. Tammy's calling in tonight from Hamilton. Hi there, Tammy. You're live on our show. Go ahead. Tammy, are you there? Line 7. I'm very sorry. We're going to have to move on now. Let's go to line 8. And Chris is calling in tonight from Toronto. Hi, Chris. Can you hear us now?
Hi.
Hi, Chris. Go ahead. Have you got a question or comment for Dr. Tarman?
Yes. How would it be possible to help someone in their 70s who's been smoking for at least, I would say 55 years, had half a lung removed due to cancer? Has been diagnosed with COPD. How does one help someone stop smoking?
You're talking just smoking tobacco?
Marijuana.
Or marijuana?
Tobacco.
Both?
No, just tobacco.
Just tobacco, yeah. Okay. Well, it sounds like if they better, I would suggest the medication, the Champix or Wellbutrin or basically Zyban. There is medication that you can use, or there's the patch or the gum. And it doesn't matter what age the person is. I think that those are all valid options.
I hope that helps. Thanks so much, Chris, for calling in. Let's go to line 3 tonight, and Kathy's calling in from Whitby. Hi, Kathy. Go ahead. Have you got a question? Hello there, Kathy. Can you hear us? You're live on the air. Okay, let's move on down to line 5, and Steve is calling in tonight from Kitchener. Hi, Steve. It's your turn. Have you got a question or a comment?
Yeah, this is Steve. I phoned him many times. I got a nephew. I think he has. Can marijuana cause post-traumatic stress disorder?
No, I've never heard of it causing post-traumatic stress disorder, but it can cause mental disorders in general. If you have post-traumatic stress disorder, I would think that it would make it worse because it enhances anxiety and it makes people get paranoid, even to the point of psychotic symptoms. There's even a high connection with schizophrenia. So I wouldn't be fooling around with marijuana if I already had a diagnosis of something like post-traumatic stress disorder.
Thank you, Dr. Tarman. Let's go back to line 7. We're going to try Tammy again. Tammy's calling in tonight from Hamilton. And Tammy's gone. All right, let's move on to line 4. Michael, you're next. Michael's calling in tonight from Oshawa.
Hello.
Hi there, Michael. Go ahead.
Yes. Hi, Doctor. Doctor, I'd like to ask a question. You know, I know that medical marijuana in some cases for people who have health issues, my mother, God rest her soul, she had ovarian cancer, and she never smoked or drank. She was about the straightest woman I've ever met in my whole life. And she was prescribed, you know, medication that she could take orally that was supposed to be like marijuana or whatever. But because of her radiation treatments and chemotherapy and stuff like that, it was impossible for her to be able to maintain not being throwing up because of the poisoning of using chemotherapy. It was quite extensive that she was taking. And, you know, at the time, you know, she was so ill, I went out and I suggested to her, you know, look, would you, Mom, be willing to consider, you know, smoking medical marijuana? Now, unfortunately, I have to admit it wasn't medical marijuana, and it put me in a position where I had to go out to the elements of the criminal side of society, which people are being arrested for selling it, and put myself in position of danger so that my mother could receive this medical marijuana as we have today, right, which would have been a lot easier on me in that aspect, right? And when she did finally, and she could barely smoke this, I mean, it was a couple of puffs or whatever that she could take, it stopped her from throwing up. She had the ability to be able to eat. And, you know, I never thought I'd ever see this, but my mom turned to me and handed me $100 and said, Michael, you go get me some of that.
Wow.
You know.
Well, you know, Michael, you're describing the occasion when medical marijuana might be entirely appropriate. I mean, I've heard you give me a number of reasons why I would be swayed to thinking, okay, this might be worth trying. It's like doctors or myself are not saying no. It's the way that it's being put upon us, and it's the way, and it's the people who usually ask. They're not the people who are like your mother. They're young. They're generally not the people who are that sick. They're usually quite healthy and you know, could probably use other means to deal with their conditions. But fair enough. It sounds like your circumstance is quite appropriate.
Absolutely. Michael, I'm so pleased that you called in tonight to give us that perspective as well.
Yes.
Yeah,
yes.
There's both sides of the equation to this. We're going to carry on with your phone calls, but time for another short break. More from Dr. Vera Tarman, the medical director of Renascent, right after this.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Hello, I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
You're watching Living Clean, Living Well, live here on CTS. Our guest tonight, Dr. Vera Tarman. Back to our phone lines that have been lighting up tonight, which is great. Thanks for calling in, folks, because that's what we're here for. This is what we do. Let's go now to line 6, and Rebecca's calling in tonight from Thornton. Hi, Rebecca. Thanks for your patience. Go ahead. Have you got a question?
Yes, I have 2 questions. I guess my first concern is whether we're treating anxiety with medical marijuana. Like society on whole has a lot of anxiety. And, people that I speak with are very positive about medical marijuana, I'm surprised. And I just think, is it an avoidance of dealing with the real anxiety issues that we have to deal with in our culture?
Hang on a sec. We'll let Dr. Tarman weigh in on that issue, and then we'll ask you your second question.
I think that you're probably right about that we live in a very anxiety-inducing society, and that, yes, it's very easy to reach for a substance. People often talk about marijuana as chilling them, making them feel calm. And I don't think people realize that it's a stimulant. It actually creates anxiety. And the reason why a person who's smoking pot will actually feel calmer is because when you're smoking something, it goes in the brain quickly, it goes out of the brain quickly. You're in withdrawal. If you smoke 4 times a day, you're in withdrawal 3 or 4 hours later. And what's the withdrawal? It's agitation. It's anxiety. And so you smoke basically to feed your withdrawal. So it doesn't actually help anxiety, even though that is the impression exactly. It's not.
And Rebecca, you had a second question? Rebecca, you still there?
Yes.
Go ahead. That's question 1. You said you had another question?
Yes, the other question has to do with treatment centers and treatment programs where it's an absence-based from alcohol and drug programs. And I hear people talking about, marijuana is different, and marijuana can be used for physical pain when they get out of these programs. So I guess I'm more of a purist in terms of we try to help people abstain from things on a long-term basis. I'm just wondering what your thoughts are on how use of marijuana for pain purposes, if you're trying to stay clean from, let's say, your alcohol or drug of choice, what the impact is of that of being prescribed medical marijuana.
Well, I think that it's the same issue as if you have to be on opiates and you've just come off of a program and you're trying to stop, maybe you've had an opiate addiction. I mean, opiate addicts will need opiate medication at some point. But with medical marijuana, if a person has a history of addiction, I would strongly encourage them to try non-addictive methods first. I mean, there's all sorts of other pain measures that people can be taking, like anti-inflammatories, physiotherapy, all sorts of other things. Shiatsu, somebody mentioned, acupuncture. How about we look at those options rather than reach for the prescription pad of medical marijuana, which yes, it will be. It's known to be a gateway drug. I'm sorry, but addiction doctors especially know, we have the research to show that it's a gateway drug. It'll bring you back to your previous use, or it'll start you off. So find something else is going to be.
2 great questions tonight, Rebecca. Thank you so much. Let's go now to line 2, and Taylor's calling in tonight from Welland. Hi there, Taylor. You're live with Dr. Tarman. Go ahead.
Hi. I had 2 questions. I was helping a friend who's trying to get off of marijuana, and my one question was, you said earlier a joint was equivalent to 1 to 4 cigarettes. Now my question is, what is a bong equivalent to in cigarettes? Because that's the thing that I'm extremely trying to get them off of. And the other question is, they were trying to convince me that it's okay to smoke as long as they're using a vaporizer. However, I'm still against that, and I'm wondering if that is or is not better for you using a vaporizer.
Okay, so to the answer to the first question, I'm going to have to say I don't know, except that a bong, my understanding, is a fairly large joint, and the actual technicalities of it, I don't know, but my impression then is that we're talking about a huge amount of damage to the lungs. Like I said, 4, it'd probably be on the upper end of like 1 of those is equivalent to 10 cigarettes, but I don't really know. I'm going to have to just qualify that. To your second question about the vaporizer, if you're looking at the point that is it going to be less damaging to the lung compared to smoking, yes, it is less damaging. So if you're going to do it, that would be a better way to do it. However, you're still smoking something, and therefore you're still activating the addiction impulse. Anytime you smoke anything, this is why tobacco, this is why smoking cigarettes is so hard. You're smoking it, and that's what makes it very difficult. Yeah.
Okay. Yeah. Taylor, thank you so much for calling in tonight, and I hope that helps. Great insight there. Let's go now to line 3. Andrew's calling in from Brampton. Hi, Andrew. You're live on our show. Go ahead.
Hello.
Hey, hi, Andrew. Glad that you stuck around. Thanks for your patience.
Thank you. I just had a question for the doctor. I was wondering, how does someone actually function in an intense, demanding, highly structured 21 to 28 day program where you're waking up at 7 in the morning and you're going till 9 at night when you get home from an AA meeting, if they're going through protracted withdrawals from marijuana and potentially early stages of like post-acute withdrawals from alcohol. How are they supposed to function in that short period of time, and why do treatment facilities think they can turn people around?
It's a totally legitimate question, and that's one of the reasons why most treatment centers have a period of time that you have to be sober before you enter the program. Like with alcohol and cocaine, they want 72 hours because that's the worst of the withdrawal. But your point about the marijuana, I mean, this is something that it hasn't not really been an issue before because not that many people go into treatment for marijuana. But now, like for example, with Renaissance, we know that an opiate addiction takes longer than 3 days, and now we've said it's got to be 10 days for your reason. Because when a person comes in, if they haven't done that 10 days of feeling rotten, they're not going to be able to do their program. So my guess is that if marijuana becomes a bigger issue than it already is, and people seek treatment for it, which is what we anticipate, then we're going to have to say the same thing. You've got to be 10 days clean before you can come into the program.
Andrew, did you have a follow-up question, or does that answer it?
Sure, that would be great if you would let me have a follow-up question. What kind of detox is going to let you stay for, 10 days or for maybe some protracted marijuana withdrawal? I mean,
good question.
Alcohol's the main concern.
Yes.
But that's for like the first 3 days, and then maybe after a month or two, I'll start to experience what I've studied up as post-acute withdrawals.
That's right. It's a very good question. And actually, there are some detoxes that if they have the beds, and sometimes they do. I've seen people be in detoxes for 2 or 3 weeks, especially if they know they're going into a program, because the detox is willing to hold the bed until they go in because they have an end point. So it's not unheard of to actually be in there for a bit longer, and you could probably make that plan if you have a date for a treatment after that.
Well, Andrew, I hope that helps. Thank you very much for calling in. Let's go now to line 4. Dave's calling from Midland tonight. Hi there, Dave. Good to hear from you.
Hi, Teresa. How are you?
Doing well. How about you?
I'm good. I have a question for Dr. Tarman. I'm sure that I tuned in late, so I don't know what you talked about in the early part of the show, but as far as the medical marijuana goes, I'm sure there's a criteria that the patient would have to meet before the doctor would prescribe it. Now, if a doctor is just totally against it, even if you meet the criteria, can he not refuse to prescribe it, or just say that he'll only prescribe it in the pill form?
Yes, absolutely. So there's 2 points to your question. First one, the criteria. This is the reason why we are not happy about this. We don't have that criteria yet, short of the criteria we use in general, which is just try everything else before you try something that's potentially addictive. So the fact that we don't have it is already a sign that we're not ready for this. Your second point, oh my God, I forgot the second point.
Dave, why don't you go ahead? Tell her the second point.
Can the doctor refuse?
Oh yes, can the doctor refuse? Certainly they can refuse, but it's going to be much harder when the patient comes in and says, "But it's already it's legal. Why? Why are you doing this?" Whereas in the past it was much easier. And this is the reason why a clinic like the one that proposed at Yonge and Eglinton is going to exist, because they're going to capture the many doctors who are reluctant to do this. Yes, you can refuse it, but it makes the doctor in a more awkward position, and that's the whole point. They don't need that awkwardness, especially when their governing body is saying don't do it. Yeah. I mean, it just makes things really much more difficult.
Wow. Yeah. Dave, did you have a follow-up to that?
Yeah. These medical marijuana outlets, or whatever they are, I think it's just a money grab myself.
Mm-hmm.
Do you feel that as well?
Well, I mean, and as I said, they're quite explicit in seeing this as a tremendous, quote, marketing opportunity. I mean, or business opportunity. That is what it is. And our concern is, will they follow the same protocol that a family doctor is expected to follow, which is to follow up with the patient, ask about the side effects, the effects, was it useful? If it wasn't useful, then we shouldn't do it anymore. Are they going to be asked to do all of that? I somehow think that they're not going to, because they're not going to have the time to. And they don't have the resources to, because when you call something a medical marijuana, that's your focus. And thinking about other alternatives is not going to be probably on the agenda. So my guess is that you're right, Dave. It's probably, unofficially I'll say I would agree with you that it could well be a money grab. But I can't ascribe a motive to
until they get up and running.
Yes,
well,
yes.
we won't know for sure.
We won't know for sure.
Yeah.
We just hope that they'll be providing competent care.
Yeah. Thanks so much for calling in, Dave. It's always good to hear from you. It's really put the doctors in the medical world in a very difficult position,
Yes,
hasn't it?
Yes, I think it has. Yeah, I mean, they were already in a difficult position, and now it's just made it more, because now they are the gatekeepers. And I remember when I was in that situation, and Dr. Why won't you? Otherwise I'm going to be like this fellow. I have to go out on the street, and I don't want you to have to talk to people that you wouldn't otherwise talk to. But don't ask me. It's not. Yeah, you're right. It's going to make it very difficult.
So if your governing body says don't do it,
well, they recommend that you don't do it.
They don't recommend.
And so that the onus then is that if I do it, I have to show good reason to do so.
And what is that good reason? What all do you have to do?
I've tried other alternatives. First of all, I've got an appropriate diagnosis. I've done the appropriate investigations, which I somehow don't think that's going to happen in these clinics. And then that I've followed up with the intervention to make sure that it was an appropriate intervention, and that I've dealt with the side effects. I mean, it's a whole piece of work around it. And but that's it.
Yeah. So, as we take a look at these medical clinics that are now going to be coming to all of the major cities by the looks of things, it would appear, we don't know yet how it's all going to come down, but there will be doctors affiliated with these clinics, correct?
Yes, yes, there will be.
But to which standards they're held to, we don't know yet.
Well, they should be held to the same standards that we'll do, but how they will actually operationalize that, I don't know.
Yeah. Well, it'll be interesting. I have truly enjoyed tonight's show because we've had so much feedback. Did you expect that we would have these many calls?
Well, I kind of did, because I know it's a hot topic out there. Yeah.
It really is.
I'm surprised that not more people phoned in. I probably scared them away, who are more in favor of it, because I know there's a lot of people out there that think it's just fine.
Well, we had also Michael, who said that his mother had a terrible form of cancer, and the medical marijuana, well, he wasn't able to get the medical side, but the marijuana definitely helped her there. So in some cases, you have to do what you have to do.
Yes.
We're going to take our last break here on Living Clean, Living Well, but final thoughts right after this.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers. But they put me into counseling and everything here after my detox, which was the smartest thing I could have ever done. I got the real demons out of me that I wasn't able to do over the last 10 years with all those other detoxes, all those other treatment centers, from private ones to government ones. And this place has actually given me my life back.
It has been a great night of discussion and insight and sharing of information here on Living Clean, Living Well. Your final thoughts, Dr. Tarman?
Well, I'd like to say that marijuana does have some uses. I can't deny that they do, but I think that I just hope that it is used with the caution that it deserves, and it deserves a lot of caution.
For many reasons, and like you're saying, you just don't know yet. Isn't it funny? It's been around for so long. Why don't we know? What could happen and some of the terrible things that could happen to us in our bodies.
We do know. It's a question of we don't yet know if the benefits outweigh the costs, which we already know.
The costs of which we know, yeah. And most specifically is the inhaling of it and the holding, right?
It's the chronic respiratory, it's the addiction component, it's the mental health, the high link with schizophrenia. Those are the things that we do know.
Right.
It's the fact that it's a gateway to other drugs. Yes, those are the things that we know.
Yeah. And that's been proven that it is a gateway to other drugs.
Yes, it has been proven. It has been proven multiple times.
Yeah.
Yes.
Wow. Well, like I said, a great night of insight. Dr. Tarman, always good to see you. We will see you again next month. So that'll be great to see Dr. Tarman. And also, next week we've got Rick Cernick and Dawn Krokock that is going to be coming to visit us here on Living Clean, Living Well. They were with us last fall, and it was another great night of a lot of conversation, and we hope that you'll be able to join us for this show. Until then, folks, we hope that you have a good week. Thanks again for watching Living Clean, Living Well. I will see you next week.
Living Clean, Living Well has been brought to you by Freedom from Addiction and is a presentation of the Canadian Centre for Abuse Awareness.